bringing together voices in child and youth healthcare. This is CAFC Presents.
CAFC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario Research Institute, the Children's Hospital Foundation of Manitoba, the Montreal Children's Hospital Foundation, the Holland Bloorview Children's Rehabilitation Hospital Foundation, the Children's Hospital Foundation of Saskatchewan, and Trillium Health Partners. We would also like to thank the following Keystone and program partners for their ongoing contributions that support all of CAFC's programs and activities. If you have any questions or comments for our panelists, please type them into the question box at any time during the presentation. You can also share your thoughts and questions on Twitter by tagging @CAFCTweets and using the hashtag CAFCPresents. All of our webinars are recorded and can be found on the CAFC Knowledge Exchange Network. Use the CAN to share these recordings with your colleagues or register an account and post comments, links, or other resources that you think will be of interest. And be sure to sign up for the CAFC Presents weekly email newsletter to stay up to date with upcoming webinars and our recorded webinar archive.
Hello, and welcome to today's episode of CAFC Presents. I'm Lisa Stromquist, National Coordinator of Quality and Patient Safety at CAFC, the Canadian Association of Pediatric Health Centres. Today's topic will be about patient engagement in youth mental health, and we're really excited to welcome Dr. Roberta Woodgate as our panelist. Dr. Woodgate is a professor at the University of Manitoba in the College of Nursing. She also has an appointment in the Max Rady College of Medicine for the Department of Pediatrics and Child Health, University of Manitoba, and is a research scientist with the Children's Hospital Research Institute of Manitoba. She holds a CIHR chair in reproductive and child health services and policy research, and her research program, Engage, embraces a dynamic approach to involve children, youth, and families, interact with researchers and knowledge users in the research, intervention and evaluation process, and be innovative in the use of and exchange of knowledge with the combined goal of improving healthcare, access to care, and quality of life for children and youth. She works with diverse populations, empowering them to have a more active role in their health and the services affecting them, and to utilize diverse and innovative research methodologies, including arts-based methods. So it's my total pleasure to hand the podium over to Dr. Woodgate.
Hello. I'm really glad to be here today. I hope you enjoy my presentation. I just want to again thank CIHR for all the funding I've received for my chair award and also for the study that I'm going to present today. So we'll start the presentation. So today I'm going to be mainly focusing on a study that I did looking at young people experiencing anxiety disorders. Part of this too is going to be tying how we can engage young people more in research, and also looking at where do we go at the end, how to improve mental health services for young people, and also how to improve patient engagement involving young people in research. Just for those who are not familiar, as you know, CIHR has really spearheaded the notion of patient engagement in research. And based on their definition, patient engagement means meaningfully and actively collaborating in the governance, priority setting, and conduct of research. So why is this so important? Patient engagement is important because it is a means to promote, to improve practice, treatment, and research. We need to hear the voices of those most affected, how we can better improve their healthcare. So yes, patient engagement is something to be valued. Unfortunately, most of the work or the emphasis in patient engagement has been from the adult perspective. Not so much listening to the child's voice. And when I say child, I'm talking about school-age children to adolescents and young people. For some time, children's voices have been largely silenced in health research based on the premise that they are vulnerable and in the need of protection. This even despite the Convention on the Rights of the Child that has emphasized participation, that children have the right to say what they think should happen, and that they have a right to make decisions that are affecting their health and their life. But my research program, I have all through my career, my research has focused on not so much involving research on children, and that's when I say research on children, that refers to getting the perspectives of those other than the child, from adults to healthcare professionals and so on, which is very important. But as you can understand, we're missing what the child is experiencing and what they are experiencing and what will help us understand how to improve their life and health care. Over the years, my research again has been with children, so that's accessing their views from very participatory methods and also qualitative methods and also arts-based methods. And you're going to see again through this anxiety study how the engagement throughout the project had been advanced. But I just want to take the time for you to read this quote from one of my co-researchers, or I would say participants in one of my studies. And I would say in all my work, the children and young people who are in my study, really in my research, really want to be in the research to make things better for other young people. So a real foundation of my research program is emphasizing that children are experts in their own lives, and their involvement offers a researcher the opportunity for greater authenticity. At the same time, throughout the years in involving children research, young people, you really need to approach it from a human rights perspective, and also with an ethical stance. And as one young person in one of my studies looking at involving the study involved looking at young people's perspective of involving children research, this one young person had emphasized the importance of trust, and though you come in with that trust, how easily that trust can be broken. So getting to the study today that we're going to be looking at is, I was funded from CIHR looking at young people's perspectives of living with anxiety. Just a brief overview of the youth mental landscape in Canada. I'm sure, as most of you know, at least 10 to 20% of Canadian youth are affected by mental health illness or disorder in their lifetime. And what's so important is most mental health disorders begin before they're 14 years of age. And I think one of the biggest things to emphasize is children or young people with mental health disorders are often seen as the orphan child of the orphan child, because as we know, mental health, regardless adults or adolescents or children, is something that's not given the priority it should be. And if you're a child with a mental health disorder or challenge, it's even worse. So again, mental health disorders in young people should be a concern and should be a priority, and especially when you think 1 out of 5 children, and 1 out of 5 children who need mental health services, only 1 out of 5 children get the support and services. So this one of the areas that I do research in many different areas involving children and youth, but I'm very much interested in young people with anxiety disorders. And while we know there's work done with young people with anxiety disorders, looking at what causes anxiety, looking at how many young people are affected, what hasn't been really researched as much is looking at their own lived experience, what it really feels and what it means to them to be living with anxiety. And so that's the overall purpose of this study, was to look at what the lived experience was like for young people living with anxiety. The approach was mainly from phenomenology as informed by Mannon, and again, by Mannon, that allowed us to get at that lived experience. I did do some quantitative measures in this study as well, but I'm not going to be addressing that today. And one thing with Van Mannon, in addition to looking at the lived meaning and what it's to live with experience, also focuses on lived time, lived space, lived body, and lived human relationships. So this study was funded by CIHR. In the study, we had 58 young people, ages from anywhere from 10 to 22 years of age, participate, and their parents also took part in the study. I'm not going to be talking about the data from the parents today, but just focusing on the young people due to the time frame of this presentation. We interviewed the young people, open-ended interviews. We first interviewed them, and then we gave them a camera to go out into their world to take pictures of what it felt like to live with anxiety, things that caused anxiety, and just other things that represented them to what it's like to live with anxiety. So the youth were involved in the photovoice process. After they took the pictures, we then interviewed the youth again to talk about the pictures, also to follow up on questions from the first interview. The interviews that the young people took part in were very extensive. Each participant took part in 2 interviews. The interviews lasted anywhere from, I would say, a minimum of 80 pages. And for the total of all the photos that involving the 58 youth, we had over 500 photos. Quite a bit of data, and again, today I'm only going to be presenting as a portion of the data for the youth. In addition to the photos we had the youth take, we also had them do eco maps. So they would draw maps of their own relationships that they have with other people in their lives, whether the relationships are strong or weak, and also activities that they did, and so on, just to get a sense of what their social worlds are like. So again, this was the data that I'll be presenting today. So, and I think one thing is I've used photovoice before with other studies, but for these young people, it really worked well for them, because I think one of the things is it gave them the power to share their story, and in a way that was creative. So I was for a data collection method for this study was very successful. So as you can anticipate, for these young people, living with anxiety really consumed their lives. It captured every part of their lives. And as this one young person said, anxiety is being scared, pretty much. It's for me, it's the fear of the unknown, and the fear that a million different situations will happen that are so unlikely. And if you end up actually going and doing the thing that you're anxious about, what you're scared of usually doesn't happen. The anxiety, for many of the young people living with anxiety, it impacted their daily lives. They woke up, from the minute they woke up, their lives were impacted by overthinking various what worst case scenarios, by trying to hide the anxiety, track normal, and for many, there was a sense of perfectionism and being that perfect person. I must say, the interviews were very, when you would, just listening to what these young people have to say, when the anxiety really, it really emphasizes not to minimize what it's like to live with anxiety. For many, it reduced their ability to participate in everyday life, and preventing them from things that they would like to do. Now here's just one example of a photo, and again, I wish I could share all the photos and the different meanings that the young people talked about in living with anxiety, and also the very many metaphors. But this one young person took a photo of a burning fire, and I'd just like you to take a time to read what they're saying in this photo, what the young person is saying in this photo. So as you can see, this analogy of a fire, just as one person said, the smallest little spark can start a fire. But I also put it in the fire pit because what people think that I need to learn is how to control it or how to harness it. It is something good to do. Again, you see how powerful this image is, and how just how the anxiety impacts these young people. And again, I wish I could share all the photos when it comes to what the meanings are for young people living with anxiety. But this is just one of many powerful photos that the young people took. So lived time. For these young people in the study, time was it was like they were in between. They feared the future, but also lived in the past. Time played a central role in the lives of many of the young people in the study. Well, with one youth going so far as to say that it was the foremost reason for his anxiety. The interrelationship between time and anxiety was so great for many that even the sound of their alarm clock served as a source of their anxiety. Many of the youth took pictures of clocks or time or anything that represented time. And so time was a very, really consumed their lives. And here's again just an example of some quotes from the young people looking at how they lived in the past and also feared the future. And so living in that moment was hard for them. So just take your time to read these quotes. And so again, it's really fearing the past and fearing the future. Always thinking about what they did wrong in the past, and also thinking about what they may have to do in the future. Lived space was really big for these young people in the study. And what was interesting too, many of the young people took pictures of, two contrasts, taking pictures of, the busyness of the city life, urban pictures and these were things that really young people, it caused a lot of stress for the young people. But what really helped them to, for many people, a way of coping was going into nature. But this one picture was especially interesting because it had a picture of nature, but also up against some urban landscape. And young people would talk about feeling trapped within, busy streets or busy areas, and to get away from it would be also, again, to, have some sense of being with nature. And as this one young person emphasized, like about feeling trapped, and, you don't feel trapped within nature, but here nature is being trapped because it's against industrialization. So lived space was, the lived space also, when it came to being with school, in their school, was also an issue raised repeatedly in the research interviews. They taught the whole notion of just getting out past their front door to go to school also put a lot of fear into some of the young people. And many of the young people would avoid being seen in the school environment, and by doing that, they would sometimes, some of the young people spoke about coming to school late, so they wouldn't have to be in front of the, where the crowds of all their peers. They also talk about avoiding, like one young person talked about avoiding to lock up her bike because there were students around her. Another issue with space in school it was the issue of being in the gym or being in the cafeteria. For a lot of the young people, this evoked a lot of fear and anxiety in them. So space was a big issue, and again, just getting out that front door. And there was more than one young person who took pictures of the whole issue of going past that front door. And then here, they will also talk about spaces that were comfortable. And within their home, they could have spaces that were comfortable within their home, but also spaces that were not comfortable. So again, this one young person said, finding a place that you're comfortable in. Like, it's not just that the chair is comfortable. I just feel better if I sit in that chair. I don't know why. And again, just to share with this interview, this quote from a young person about having to be with her, doing her social study exams, and being around a big crowd. So for the school environment, for many of the young people, it was not always a safe space. And again, just walking into a crowd could provoke a lot of anxiety for these young people. And again, here this emphasizes about being at the gym entrance and showing up when a bunch of other people show up with you. And also, when they spoke at school, they also came in relation to their lived space. They also shared many instances of being bullied. And just if you could take some time to read these quotes about the notion of being bullied. For the youth who were on the receiving end of being bullied, they were actually aware of the power dynamics between them and those who were bullying them, and the ways in which bullying was negatively affecting their entire school experience. And at least from the youth in this study, little was done, at least from the youth's perspective, little was done by school authorities to address bullying, even in situations where the school administrators were aware of the bullying. And to be fair, again, we didn't interview anyone in the school, but many of the youth spoke about, you know, this not being attended to. Understandably, another key finding was the way in which anxiety impacts the body, including young people's physical health and the pain that comes with living with anxiety. They spoke of always feeling uncomfortable. And here's one quote from one young male. He talked about the mental pain and, you know, feeling bruised or feeling like it was being bruised. And many of the youth would talk about, you know, how their body felt like it was going through. Some of the expressions they would use would be like walking through black sludge, or as if they were in cement, or having this heavy backpack on their shoulders all the time. And here's another young person who, in addition to how they felt about how living with anxiety made them feel, they had also you know, talked about feeling uncomfortable in front of mirrors, or, you know, having people look at them because they felt uncomfortable within their bodies. As this one young person just didn't feel uncomfortable about going to the washroom because of the mirrors. The issue of body image was a recurring theme among both males and females. Young people talk about despising themselves, how they look, how they view. They again talked about the fear of being seen in everyday life, and such leaving their home to be outdoors, which youth recognize as an effective coping strategy to deal with the isolation and loneliness. And just want to share with this picture, this one young girl took this picture of her shadow. And here again, she talks about hating her shadow. And she talked about how it made her look like how she sees herself being smaller, but how the shadow made it look bigger. And there were many of the youth really did share about this despising of how they felt about themselves. Now, for the relationships, for some of the youth in this study, relationships with their parents, siblings, friends, and so on were often complicated and changing as a result of their anxiety. As part of the study, participants, as I mentioned previously, completed eco-maps, which are essentially snapshots of various people, places, and events in their lives. Young people were asked to identify the strength of the relationships. And I just want to share with you two examples. The examples above of these examples show two different snapshots of the importance of relationships to young people. In both, the solid lines were meant to identify positive relationships, while the dotted lines were relationships that were a little bit more stressful. And again, we had youth do these eco maps at numerous times, and these relationships did change for some of the young people. And as you can see, with the young girl, the 16-year-old, she had more relationships compared to the young male with this photograph, with this eco map. Young people also shared with us that at times the adults in their lives did not understand them or their experience, and even made assumptions about their lives and about living with anxiety. But also, to be fair, at the same time, having a strong social network was identified as a major coping strategy for young people, helping them to manage their lives living with anxiety. And again, with working with the, having young people talk about the professionals in their lives, so like therapists, teachers, and so on. And again, that was really important, how they treated them. And if you take time just to read this one quote. Youth in the study spoke about the importance of trust and respect with their healthcare providers, and especially the challenge of trying to advocate for their own, and they also spoke of the challenge of trying to advocate for their own health in situations where they thought there was unequal power dynamics between them and their health professionals. Youth were also very aware of the tendency for healthcare professionals to discuss their mental health solely in a medical way, and wanted instead to talk about more than just their mental health, but who they are as a person. Along with the relationships was this notion of stigma, how they felt stigmatized by other people, but also they had their own internalized stigma. And this one young person took a picture of this journal, and in the journal it says, to judge a man by his weakest link or deed is like judging the power of the, and so again emphasizing how people, they felt being judged by others. In addition, so to get to really get others to understand what it's like to experience anxiety, one of the knowledge translation projects that we did, and it's just one so far. We're doing many more, and again, this only depicts one part of the findings. But what I did was I took a couple of the major themes for young people, working with the young people on our youth advisory committee, walking through what it's like to be a young person living with anxiety from the moment they get up to the moment that they go to bed. And I worked with a young choreographer in Winnipeg, from the Royal Winnipeg Ballet, and we did 5 short videos of what it's like to get up from the morning to going to bed. And again, the videos are based on the themes, as well as what you hear in the videos are also quotes, actual quotes from young people in this study. We showcased these videos at an event in January in Winnipeg, and these videos now, the reason why we did them again is to get a sense of what it's, for people to understand what it's like to live with anxiety, but also I'm working with the school divisions, and we're going to be using these videos as a way of using for teaching tools for young people in schools. So the videos are, and they're going to be posted by CAPC, but they are available in French and English. And once we have the educational materials, we'll also be able to send them to anyone who's interested. They're also being currently translated into Cree as well. But I'm just going to walk you through what each video represents, and then we're going to show one of the videos. And unfortunately, because it goes through this webinar system, when you see just one of the videos, it's going to be a little bit shaky. But if you have time, take some time today to look at these videos. So the first video in the morning, it's referred to hiding the struggle, and this short video reveals how young people living with anxiety struggle with a sense of self, the pain that they feel and having to hide the anxiety that comes along with living with anxiety. And then this the next video takes it to getting out that front door and all the things that everyday tasks that like you and I take for granted really can be difficult for a young person living with anxiety, and how, you know, it's more difficult to do these tasks. It's that whole notion of that fear of the unknown. And again, though, young people were resilient and did have ways of coping. And the next video, Taking Up Space, reflects how young people living with anxiety at times, you know, we feel bombarded by the sounds of everyday life, and how nature and outdoors can help to rejuvenate them. And then the next video, again, just talks about generally how young people feel different in living with anxiety, and how they feel different from everyone else around them. And the feeling different in this particular video refers to having them take medication, but that's not the only reason. So there's other reasons for feeling different, having to see a doctor, seeking assistance in school. And again, just to emphasize that notion about stigma. And then finally, the last video talks, it's the end of the day and returning, going back to the home, and how at the end of the day, it's still, young people feel that weight of the burden of anxiety. And it's about encouraging young people to reach out to seek and offer support, and to listen to the experiences of young people. So again, these 5 videos just depict one portion of the findings of the study. I'm going to have Lisa now just show just the first video, and that's getting up. That's that video, just, you know, just getting up in the morning.
You might not be able to see right now that I'm a little anxious. My lips are quite straight, considering. Because people don't go like this all the time. And it looks like everything, not in a gross way, but like everything has gone or moved down. Everything's been anchored in, like in my face and in my body. Because my shoulders sag, and my knees are like bent a little bit, because it's like not wanting to stand up anymore. It's heavy. So I hide it. I look normal from the outside, but really I feel totally different on the inside.
So I just want to acknowledge the person the choreographer who I worked with these ballets is Philippe Alexander Jacques from the Royal Winnipeg Ballet, and the dancers, there was a different dancer in each ballet, and the young people from the aspirin program of the Royal Winnipeg Ballet, and the film company was Worky Films, and they were fabulous. They really got what the themes, what we want to depict in the themes. And so again, we're going to be using these with teaching tools, and hope you'll have a chance to get to look at these sometime. And then once we get teaching materials, anyone who's interested, we'll be able to forward them to you. And again, though, this is just one way of depicting what it's like for these young people. So again, I'm only able to share some of the findings on what it's like for young people. But young people also.
Roberta, just sorry to interrupt. You're just going to have to click share your screen again because we've given you back. So there should be a little dialog box. There we go. Okay. Perfect. Thank you.
So were you able to hear what I said before, or just?
Yes, we could hear you just fine. So it was a great message. Thank you. So in addition to telling us what it was like, they also shared with us how people around them can help them, or what they should be able, what they should and shouldn't do. And again, very from what they said is, I think it has been reported in other studies, but again, it's that whole notion of understanding, being patient, really, giving them space, like not to push them, and just really being open-minded and listening. They also really talked a lot, and this is just some of the quotes that that I'm sharing with you. Talked about what health professionals can do, and again, what teachers can do. They talked a lot about teachers because that was a big part of their lives. And again, just take some time to read some of these quotes from the young people. Again, it's really about that, having that patience and really understanding them. I'm just going to skip this slide just because of time. And there was a lot about what young people would say about what you should say to a young person with anxiety and what you should not say. And these are just some of the things that the youth would say about not to say, like if you hear the word relax, so don't worry, or you're too young to have anxiety, or it's all in your head. And these are things that young people in our study had others say to them that really, again, these are just examples about how it really just caused them to be more anxious. And some of the things that we can say to young people include is, asking, is there anything I can do to help? Just, it's okay, we can figure it out. Like, we don't have to have the answer right away. Again, just taking that gentle approach. So I want to just talk a little bit about, again, the importance of engaging young people in research, and how, in addition, for some of the young people who were in the study, where they shared with us what what it was like for them, how they also were actually like co-researchers. But again, when we asked the young people why they wanted to be in this study, here are just some of the things that young people would say. And again, it was about having a voice, and really, or they have a voice, amplifying their voice, and really being able to help out other people. They wanted people to know that anxiety was real, that it's something that they choose not to have. And again, I think, considering that some the social anxiety that's associated with having anxiety disorder, for these young people even to participate in this study, that was really an accomplishment for them. Along the way during the study, we developed a youth advisory committee from some of the young people who participated, who were in the study, and they contributed to the interview guide, like looking at what questions are important, what questions we should be asking. Also, the youth advisory committee, they felt it was really important that they develop their own website, and so currently we're in the process of developing this website. And I know there's lots of websites out there about
so it's not a replacement of current websites, but it's more about youth are sharing, it's in their own words, what it's like to have anxiety and what things help and what things don't help. And eventually we do hope to expand this website, but right now we're just in the process of developing it. So again, this one young person said, I thought that it would be good to put my input into something like this cause. It's something that people really shine a light, or even though it's a problem. And I guess I just kind of feel like a little bit of sense of accomplishment, seeing as my input on this is going to be made for good use. So we meet regularly with a group of advisors who are from the study, and we're solely developing this this website. Again, another important part of engaging the young people, we're going to be having a photo exhibit to take place in the summertime. So we'll be having the photos, some of the photos from the study and the youth who were in the study, and we're going to be hoping to showcase the photos in a public place. And then again, as youth, as co-researchers, an example of having this photo exhibit. Just looking at this photo, this is about what, again, when I showed you the photo of the fire, and again, we have so many other fabulous photos, and again, you look at this photo and she described herself as, you know, the dead grass is the person with anxiety, and all the other people around are the healthy green grass. As co-researchers, some of the youth also participated in the event that we had for the display of the videos that took place. So where do we go from here when it comes to just mental health and how to improve the lives of young people with anxiety? So some of the suggestions that are on this slide are, again, came from what young people suggested, what parents suggested. And I don't think when you look at it, it's nothing new, but it's just things that we really need to act on. Again, young people study want increased access to the right services. Some wanted drop-in counseling. For families express, at least the parents express, need for respite. So again, some of these suggestions are not, I would say, probably not new, but again, need to be acted on. And again, it confirms what these young people suggested in the study confirms that, yeah, this is what we need to act on. And then the next thing, where we go from here when it comes to engaging youth in research, the youth in our advisory study, it takes time for them. And I think we really have to, when we talk about patient engagement, we really have to be authentic and really recognize the expertise and agency of youth. At the same time, recognize that, you know, this involves additional resources, timing, funding, and so on. Lastly, what I want to show to you, when it comes to, I developed this model, which, while it's meant for research, I think it can really be used for practicing in caring for young people with mental health challenges. So the article that will be discussing this model is going to be published in the International Journal of Qualitative Methods. And again, it just talks about how, when you're engaging young people in research and in practice, some of the qualities and attributes that you need to have. And I'm not going to go through these attributes just to allow for questions. But again, if you have once this is published, if you have time to take a look at this, you may find this of value. And finally, I just want to share one young person's photos. There were some very positive and very photos that, you know, that really emphasize the resiliency of young people. And this young person, you know, talked about, you know, her love of traveling and looking at taking photos of buildings and so on. So if you just take some time just to read this last quote. I think we can open it up now for questions. So if anyone has any questions or comments or anything that they'd like to add.
Sure. Thanks so much, Dr. Woodgate. This was fabulous, and I just I'm so impressed by how articulate these young people are in expressing how they're feeling, you know, through the photographs, through their words. It's
I have to say, and again, this is just one snapshot, and we have a lot of data to analyze, but what you said was exactly what these young people spoke about and the photos, I mean, really, I was blown away by what these young people shared with us, and I said also shared with us, because you go into their lives when you're, as a researcher, you're a stranger, and how much they trust you to to make sure that you're really getting their story.
Yeah, it's, I just want to remind everybody, I don't have any questions. Hopefully people are typing questions and comments in the pane right now. Just a reminder, type them into the question pane in the control panel on the right side of your screen. We've uploaded the presentation. You can just download it from the control panel on the side, and we've posted the links to the to those videos, which were also just outstanding. Those will also be on our Knowledge Exchange network, as will the recorded presentation. So just to remind everybody. Somebody's saying, I think the videos are amazing. Can we share these with our clients?
Yeah, please do. And again, once we get, like I said, I'm going to be meeting with some of the teachers from one of our school divisions, and we do want to develop some educational materials. I think these videos would be a fabulous way of getting young people to talk about, this is your experience. So yes, the more you can send them out, and once I get them up on Cree, the link, I will share that with you too. So the more you can get up, the better. That would be I really would appreciate that.
Great. We have a great network for sharing all of this information. So I think there's a good community with a lot of interest. So people are commenting that they'd like to see the slides again on what we can do. And really, they're saying it's quite powerful. A lot of really positive comments about this work, Roberta. It's people are really impressed with the youth, and the way that you've been able to engage them, I think, is that trust that you built has been quite powerful.
And again, I want to emphasize, CIHR really emphasizes patient engagement, which I think is very important. But again, to really do it authentically, I think there's time, support, whatever, all multiple things that we need to consider, and really, to value what they're saying.
Mm-hmm. So it seems that you had really great participation from the youth. Were there any big challenges in getting them to open up, and or were they pretty open to the discussions?
Some of them, it took time, and when I say they were interviewed twice, some of them were interviewed more than twice, because of that. Because again, for some who had social anxiety, it's harder to talk and share what they're feeling. But truly, most of the interviews for all the young people were over 80 pages. And my own experience has been in interviewing young people with different challenges. And again, I don't focus on the disease. It's more about I take a non-categorical approach when it comes to understanding what young people are going through. But I think for many of these young people, they haven't had a chance to really talk about what it feels like, and to really be listened to, not going into an appointment saying, okay, were you able to do whatever. It's really about listening to them, and not about, okay, what is your health like today?
Mm-hmm. Yeah, there were more comments here about the way that you've represented the youth's ideas and their thoughts, and somebody said that it's definitely more enjoyable than reading a journal, looking at this information this way. So a great way to represent the research.
And we are right now working with the youth, again, some of the youth who participate in the study. We're going to be doing some other knowledge translation activities that really will be valued for youth.
Great. And will you be able, I suppose you'll be able to use this sort of model, this process that you've developed in other types of research involving youth, right?
Yes, and again, I think it's something that it's a value for research, but it could also be a way for using in practice, how we approach our patients.
Mm-hmm. No, again, people are very interested and very, like we keep saying, blown away by the work and this research. So I don't see any more questions on there right now. Do you have any sort of final thoughts or sort of last word?
I think, well, I guess this has always been my soapbox, but when it comes to research, we really need to do research with young people, not on young people, at least for the type of work I do. And, the value that you get in engaging them, and you want to engage them, so just not for the sake of engaging, but more so, how can we improve their health services and programs and so on. So I think this is the why I do this work, and I think it's really to make it better for young people.
Yes. Oh, actually, I've got another comment here. So many of these examples seem like the subjects are very self-aware of the impact their anxiety has on themselves. What about working with young people who aren't at that point yet?
Yeah, and we didn't. There were some people who were in the study who, I wouldn't say early diagnosed. Some of them hadn't even been diagnosed as yet, but they were diagnosed, but they didn't really have any treatment. And those were probably the ones. I can't really say there weren't any who weren't self-aware, but that's a valid point. The other issue too are those ones who have anxiety but are able to function in everyday life, who somehow get, not missed, but they're living with anxiety, but they're able to get through the daily tasks, and those, if anything, those are some of the youth that you think, wow, they're not going to get the help because they are managing.
Yeah, it's a big risk. People who seem to be able to normalize their anxiety and just keep moving forward. Yeah. Yes, I think Shane had the last word, and so I just wanted to thank you so much, Dr. Woodgate. This was fabulous, and again, a reminder to everybody that we will post the recording on our Knowledge Exchange Network. So we do our webinars every Wednesday at 11 a.m. Eastern Time, and it's always great if you can watch live, as the questions and comments can really enrich the discussion. Like I mentioned before, if you can't watch live, the recordings of the sessions are available on our Knowledge Exchange Network. So next week on April 5th, we'll be welcoming Dr. Christine Weckerly and Dr. Delphine Collin-Vesna to talk about trauma-informed care, youth sexual and non-sexual violence experiences, and the attachment, regulation, and competence model. And on April 12th, our topic comes to us from the Canadian Pediatric Society on how there is no simple answer. Highlights of the CPS statement on antenatal counseling and management for anticipated extremely preterm birth. And we'll be hearing from the co-lead authors of these position statements, Dr. Brigitte Lemire and Dr. Gregory Moore. So some great stuff coming up, and thanks for joining us today, and we hope to see you back here next week. Thanks very much.